Let me just take the
Great. Oh, you good?
Yep.
Good afternoon, everyone. Thanks for joining us on a cold, snowy day and the Friday before Family Day long weekend, which unfortunately most of us are probably not going to be able to see our extended family under the circumstances. So I appreciate you taking the time to join us to talk about a really important topic anytime, but I think especially during the pandemic. And before I introduce my special guest today, I just want to take a moment to say that I'm joining you from my home. And wherever you are joining us today in Ontario, we're all on traditional Indigenous land. And the land where my home is situated is on the treaty lands of the Mississaugas of the Credit First Nation, which is covered under Treaty 13, the Between the Lakes Purchase. And I also want to just take a moment to reaffirm the Green Party's commitment to the truth and reconciliation process, and to also acknowledge, especially given the topic that we're covering today, just the role and way in which colonialism and systemic racism have created barriers for Indigenous people, but especially to healthcare services. And just, I think that was highlighted tragically last year when the video of Joyce Excowan came out. And just to say that, I think we all have an important role to play in breaking down barriers to all services, but especially healthcare. And I also want to take a moment. My colleague and friend, MPP Laura May Lindo, texted me this morning and said, "Hey, I think you're doing a Facebook Live event on systemic racism and healthcare services, so I'm going to join you." And so, Laura May, if you have joined us, I just want to say that I always look for opportunities to work across party lines. And MPP Lindo and I, her representing Kitchener Center, me representing Guelph, so same region. The two of us have really, I think, worked hard across party lines to work together on a variety of issues, but in particular, issues around systemic racism. And so I am excited today to be joined by just an expert and a real champion in promoting community healthcare, Cheryl Prescod, who's the executive director of the Black Creek Community Health Center, which is located in Toronto. And Cheryl has worked hard throughout her career to ensure equitable access to healthcare services for vulnerable populations. She's been a dedicated community leader for over 25 years as a coalition builder, bringing together diverse stakeholders and community development initiatives that reflect the needs of people, especially in her community. She facilitates numerous community academic partnerships and research to build evidence that informs policy and innovative approaches to complex problems in marginalized communities. Her current leadership roles include co-chair of the Northwest Toronto Ontario Health Team, advisory member of the York University Community Engagement Center, and the Sarah Mark Immunity Project, and is a member of the board of directors of the Canadian Mental Health Association, Toronto. Cheryl has an academic background in biological sciences with graduate degrees from the universities of Ottawa and Toronto, and leadership and training in healthcare and non-profit management from the Rotman School of Management, the Schulich School of Business, and the Harvard Business School. So I'm obviously with somebody who has many more degrees than I have today, Cheryl. But I want to also just say that Cheryl made a point to say that she values the quality time she spends with family and friends to maintain an optimal work-life balance, which I think is so important, especially during the pandemic. So Cheryl, I just want to just say how much I really appreciate you joining us today and being a part of this conversation. And I want to thank everyone from across the province who's joining us as well. As you know, many people in Ontario may not be as familiar as we need to be about the topic of racism in healthcare. And so I want to begin today by first talking about what that phrase means. And so, Cheryl, based on your professional experience, can you help shed some light on this issue and why racism in healthcare remains a critical issue in Ontario today?
Thanks so much, Mike, for inviting me to have this important conversation, which is really important to me personally as well as professionally. But before I answer your question, I also would like to acknowledge the traditional lands that I sit at today, as well as acknowledge my ancestors of African origin who were victims of the transatlantic slave trade, and without whose struggles and hardships I would not be here today and have accomplished what I've accomplished in my personal and career life. So, and when it comes to racism, I really want us to know that it's not race that is a determinant of health, it's racism. It's how people are treated. I'm not genetically predisposed necessarily to some of the poor health outcomes that we see in the Black community. It really is about the systemic racism that exists and has existed for time, from history and ongoing today, that causes folks to not have access, not have equal access to care, that predisposes them to the chronic conditions. People who don't have access because of perhaps their lack of access to jobs, to have a living wage, so that they don't have access to good food, healthy food, to adequate housing, to even safer jobs that will give them the opportunity to stay home when they're sick. And all of this, not only has it led to poor health outcomes prior to COVID, but COVID has just illuminated this for many racialized communities, Indigenous community members, and in particular, Black community members. And I also have to add to this that anti-Black racism is also something that we have to pay some attention to, especially after the George Floyd killing that everyone around the world witnessed down south, and recognize that this is something that we do have to work specifically towards eliminating as well.
Yeah, no, the murder of George Floyd last summer, I mean, unfortunately not surprising, but still shocking to see that 9 minutes of video and just what awareness it sparked around the world, and especially here in Canada. Absolutely. It's interesting, the COVID pandemic, I think it's clear, has disproportionately affected Black, Indigenous, people of color communities across Ontario, across Canada, across North America, disproportionately. And, one of the things that really troubled me was the lack of collecting of race-based data to really highlight those disparities and systemic barriers in the way in which racialized communities were being disproportionately affected. So it was good that finally in the summer, the province of Ontario made a commitment to start collecting race-based data. But I was hoping that maybe you could just highlight why it is so important to collect race-based data, and then what types of actions we need to take to use that data and to make informed policy decisions.
That's a great question. I know that in some areas, folks disagree with the idea of collecting race-based data because there's a thing. The thought is that this will further discriminate and put folks in boxes, and may lead to some further negative outcomes. However, many of us feel that collecting the data will give us information that's necessary to plan more effectively, so that we can, again, we all work from an evidence-based perspective. We want to know that whatever we're doing, whatever strategies we're implementing, really reaches those that are impacted by the problem, whatever the problem is. So last year, I think when this pandemic hit, a group of health leaders really advocated for that continued collection of race-based data. The community health centers actually have been doing this for a long time. And because we work with communities on the ground, this is an important piece of information for us to have, so that we can plan our services based on the population we serve. So if I'm serving a population of South Asians, I would like to know, give me some data so that it really validates what we're planning. It's no different here. It's so important that we collect that information, and it's done, again, systematically, not only by some parts of our system, but by everyone, so that we can look at this data. And we saw when the city of Toronto started collecting the data, especially during COVID, we saw the disproportionate impact. We saw the numbers of the positivity rates in the Black community, in Latin communities versus the white community, for example. We saw the numbers of people in low income. And as a result, it's not only race, it's also the racialization of poverty that came out of all of this, and how people living in low income situations were disproportionately impacted. So now, what can we do with that information? How can we target those areas with those high numbers and give them the supports they need? And ultimately as well to put in place not only Band-Aid solutions, but long-term solutions to the problem.
Yeah, and one of the things I really admire about the work that community health centers do, and I'm very lucky in Guelph, my office is literally like a block from the Guelph Community Health Center, which does fantastic work in our community as well, is addressing the social determinants of health. And I think you've alluded to that in a couple times now in your answers. So I was just wanted to give you an opportunity, maybe just for our viewers, to discuss what are the social determinants of health and how do those socioeconomic factors affect people's health outcomes.
Okay, so a shout out to my colleague, Rochelle Devereaux at Guelph CHC. We're a very close-knit community, our CHCs, and I know that we work equally hard wherever we happen to be in the province to support, especially the most vulnerable in our communities. And our doors are always open to figure out what services we can offer, because the social determinants of health really impact those health outcomes, probably more so, and data shows this, than our genetic makeup, as I said earlier. It's the ability of people to have safe housing, safe jobs. And I'm using the word safe because safety to me means, if I have a job that ensures that if I'm sick, I'm able to have paid sick days, I will most likely take those days and take care of myself. And hence my health will be improved. And so many folks do not have access to that. And again, if I don't have a job, I will not have access to food. I will not have access I will not have a social infrastructure around me that again promotes good health. So, and again, in the COVID pandemic, we saw all of this come to light. We saw the folks who were in those precarious situations, who had barriers to the social determinants of health, the essential workers. And these were not only healthcare workers, these were the store clerks, the distribution site workers, the delivery workers. And in our community, for example, we have a lot of folks who are social PSWs working not only one job, but multiple jobs to ensure that they're able to pay their bills. And these are folks that ensure that we're, again, the rest of us who have the privilege of working from home, get our food delivered, get our loved ones taken care of. And, they're not, again, the salary levels that they have are not amenable to a living wage. And this is what it is, socioeconomic and socio-demographics. As I said earlier, it's often the racialized individuals as well that are in these kinds of jobs. And we see that racialization of poverty, which translates to poor health outcomes. And we know with COVID, again, the virus is much more, is impacting those at risk. And when you're at risk because you have diabetes or you have other chronic conditions, or you're working so hard that you're not resting, you will be impacted the most. And not surprisingly, those numbers, the data that was collected really showed that.
Yeah, it's interesting. I really appreciate you bringing up workplaces and the safety of workplaces, because that's been a big issue for me lately, because I think it's going to be vital to containing the spread of the virus. And it's interesting because a lot of the essential work that's out there that required people to go into work, whether it's an Amazon warehouse or a PSW at in a healthcare facility or a grocery store clerk, a disproportionate number of those jobs are held by people from racialized communities. And so just the importance of policies like paid sick days, the ability to refuse unsafe work. Maybe you could just highlight why those types of issues around safe workplaces is so important to containing the spread of the virus and keeping our community safe.
Well, I think if those individuals feel that they have no choice but to take those jobs, accept those jobs, again, at very low wages, and if they cannot miss a day of work because they will not get paid, they will go to work when they're sick. And they're often these workplaces also are, their physical spaces are often not even the best, and people are in close contact and they will transmit the virus to each other. Not only that, they travel to those workplaces, often on public transit. And I know that one of the things we noted in our in the area that Black Creek Community Health Center is located, the bus lines, the buses are crowded. There's not enough buses on the routes of where we know that there are lots more people traveling to work, to and from work. So the spread will just increase. And I often say that, there are no walls around some of these communities, and the travel that the transportation piece is so crucial, because people will go out of the neighborhood and go to other places, and the spread will continue. In order to contain this, we have to take care of everybody, including those workers who are traveling back and forth to work and who are working in those unsafe workplaces.
Yeah, and so I think for me, what's your response really highlights when we talk about systemic racism, systemic barriers. Oftentimes you don't have a choice but to get on that crowded bus. You don't have a choice but to go to that crowded workplace. You don't have a choice when you don't have paid sick days, and all of those create systemic differences in health outcomes for people. And that's one of the things that I really appreciate about the work that community health centers do, and your work specifically, Cheryl, is just highlighting how those systemic issues affect people's health outcomes. And I'm curious if you have some thoughts on what are some of the policies that we could be implementing at the provincial level. So I'm going back to Queen's Park on Tuesday. What are some of the things I can be talking about from a policy perspective that can improve outcomes for Black, Indigenous, people of color communities?
Again, I mentioned it, and everyone's talking about the paid sick days is one. I have to say that, even I have a young adult children, and my daughter sent me a text the other day. She had just started a new job, and she was not feeling well. And she was afraid to say that she had to leave because she was not feeling well. And of course I encouraged her to leave because she's sick and you're not to go to work. But not everyone has that confidence, I guess, to say that they can leave work because they're sick, because they have no choice. They can't afford to miss those few hours of pay, a paycheck. So really doing something systemically about the paid sick time for folks. The other issue that we're seeing is just, again, related to income. If people are being evicted from their homes because they're not able to pay their rent. And while, early on in the pandemic, there was a moratorium on evictions, people are still being turned away and told that they have to leave. And today we started this call. It's a bitterly cold day in Toronto anyway, and we know that the situation for people that are homeless is already dire. So we need to do something again to ensure that people are properly housed. Housing is a big issue, but even those that are housed are also precariously housed at times, because if and it's all related again to income security. So I mentioned sick time, and all of these are related. Evictions specifically, that we're seeing. Access to food. Access to food has been a big problem. And the solutions we're seeing right now are band-aids to a flood. and we can't, and we won't contain that bleed until we do something more better. And my biggest concern is, as we move into a recovery phase from COVID, those most vulnerable again will be left behind. So systems and legislation has to be put in place to protect those folks that are most vulnerable.
Yeah. So, thank you for raising that, Cheryl. And sorry, I got distracted because somebody asked if we could do a question off of Facebook. So I'll do that in a second. But I wanted to ask you another question first. Is so given the vulnerabilities that racialized communities face, especially since disproportionately fulfill essential work roles, what are your thoughts on vaccine rollout and making sure the vaccine rollout it happens in an equitable way, and ensuring that the most vulnerable folks in our society have access to vaccines in a timely and equitable fashion?
I think when I hear that question, what we've been seeing a lot in the discussions around the vaccine rollout, even around dealing with COVID, it's very much focused on the clinical and medical issues of the disease. And as we talked about earlier, the social determinants of health play such a big role in people's circumstances and health outcomes. So we really have to ensure that we have that social determinants of health and equity lens when we're planning the vaccine rollout. So let's think about those folks who cannot take time off work, for example, to be vaccinated, to go to a clinic or a space. Let's think about those populations, the folks, the Indigenous populations, the Black populations that are, I guess, they lack confidence even in the vaccine, and we have to be targeted in our approach to those communities so that there will be a higher uptake of the vaccine, but put them at close to the front of the line. We do understand, we don't want this to become I'm more important than you are. However, we have to really be thoughtful and mindful of the bigger picture. This is not an individual problem, and this is bigger than us, and we have to really make sure that we use that equity lens to ensure that we're protecting those that have less access, because they are the ones who will continue to be sick and continue to spread that virus out there.
Yeah, and I think sometimes I feel frustration when people talk about vaccine hesitancy, particularly from the Black perspective of the Black community and the Indigenous community. And my response to that sometimes is like, well, don't you study history? Like, if you look at the historical reasons of why particularly Black and Indigenous people would be suspicious of the healthcare system. And can you maybe just expand on that a little bit, and why there would be some vaccine hesitancy given the historical discrimination people have faced in our healthcare system?
Again, yes, this has been just such an ongoing conversation around, within our healthcare system. Why is it? And we tend to have this sort of let's blame those folks who aren't as confident in our system. But folks there are historical reasons. There are historical reasons why members of the Black community, as well as the Indigenous community, do not trust our systems. And it's not only healthcare, it's many different systems. These are individuals historically that were used as guinea pigs in scientific studies, the Tuskegee studies for the Black community, slave women that were used for gynecological studies. So despite the science of the vaccine, and because of my background in science, I know I trust the vaccine. I trust how it was made, how the decisions that were made around approvals. I have confidence in it. And however, I also have to listen to those folks who have been not only historically mistreated, but continue to be mistreated daily in their lives. You know, and as a Black woman of Black children, I've seen and I've experienced racism myself. I have a Black son who has been mistreated by the police system. So I'm not speaking, you know, from a place of ignorance. I'm speaking from a place of lived experience. And I do understand, but we have to have the conversations, and we have to listen to people and include folks in the discussions. My suggestion, and the way we've dealt with the COVID crisis in the community, is to include our community members in the strategies. We've included community ambassadors in rollout of testing, because people did not believe in the testing either. They did not want to be tested, but now we've had a great uptake because we utilized boots on the ground, folks who live in the community to translate that knowledge into the community, to different community groups. Same thing needs to be done for the vaccine rollout. Let's engage them. It's not only the scientists and the clinicians that have that valuable knowledge. It's members of our community who can just have some sort of influence with their neighbors.
Yeah, I think I appreciate you highlighting how important the lived experience is and the community engagement is as we think about vaccine rollout. I think it's going to be vital. And I know leaders like yourself are going to play an essential role. We had somebody on the Facebook Live chat ask me that given how poorly Indigenous people have been treated by a colonial healthcare system, how important do you think Aboriginal health access centers are in providing healthcare, particularly for Indigenous people and from an Indigenous point of view?
Absolutely vital, absolutely vital. And in this case, I think it's about, again, that cultural respect for cultural norms and cultural practices. I know in the Black community, it's the same. One of the things we're advocating for is better representation within our healthcare system as well. And I see this, the same thing in the Indigenous communities. We need to have Indigenous health in Indigenous hands, basically. And similarly, for us to convince folks to uptake this vaccine, we have to ensure that they're trusted individuals that are the messengers and the delivery of the care, whether it's a vaccine or otherwise. In the Black community, I know that we're working very hard as well to have leadership so that folks could see themselves represented in the conversation, in the implementation.
Yeah, thanks for that. And I just want to say, just as in my role as an MPP, I've had some really important meetings with Indigenous folks just around the importance of having access to Indigenous healing lodges and land for those healing lodges to be located on, and just how important that community perspective is. Cheryl, I'm gonna wrap up, even though I really want to keep the conversation going about inclusion, representation, just the important role that Black women like yourself play in leadership roles and how important that is. But I'm also want to be incredibly respectful of your time. Because I am saying this partly for the audience, because when we started the chat right before we went live, Cheryl said to me, she's like, "Oh, I am so busy," and so I want to bring that up only as an opportunity to just express my sincere gratitude for you taking the time to have this conversation today, which I think is so important and so valuable for everyone who's tuning in live, but also the people who will see it on various social media channels and just express my gratitude for you taking the time, because I know how much stress and how much demand there is on your time all the time, but especially during COVID, and just, how much stress that's put on all healthcare leaders, professionals, frontline healthcare workers. And so I just want to say how much I really sincerely appreciate you taking the time today to have this conversation, and how I'd love to have another conversation where we can talk a bit more about post-COVID and how do we address systemic racism and inequities in our healthcare system post-COVID, because I think that's going to be a vital conversation for policymakers moving forward. So thank you so much.
Well, thank you. I think we are all tremendously busy, but I'm also very grateful to have a voice and to be able to share this thinking and the experiences, not necessarily my own experiences, but what I learned from the community that we serve, and we strive to improve, the health outcomes for. So this is, it's a great opportunity, and while it's a difficult time for us, I really want to just end on a hopeful note that we will get through this, and we have to continue having conversations like this. It is important. It doesn't matter how busy I am, because as I said, it's not only professional, but it's personal, because I am, someone who's living with some of these challenges myself. And I'm just grateful to have the voice, and I thank you for the invitation to share this with you and your community.
Well, thanks so much. And I'm going to take this conversation to Queen's Park when we're back next week. So thank you, Cheryl, and thanks everyone who's joined us today. This is the beginning, not the end of the conversation.
Exactly. Thank you. Have a wonderful Family Day weekend.